We're going to look at CMS Quality Measure 117, Diabetes Eye Exam. This is a telehealth eligible measure. The definition of this measure are patients 18 to 75 years old with diabetes who 1. Have an active diagnosis of retinopathy, who had a retinal or dilated exam during the past measurement period, or 2. Have no diagnosis of retinopathy, who had a retinal or dilated exam during the measurement period or in the 12 months before, meaning every other year. Any of the following tests are acceptable for this measure. 1. A dilated retinal exam with interpretation by an ophthalmologist or optometrist that is documented and reviewed. 2. 7 standard field stereoscopic photos with interpretation by ophthalmologist or optometrist that is documented and reviewed. 3. Similar 7 standard field stereoscopic photos with the AI equivalent of the ophthalmology review. Or 4. A patient with low-risk retinopathy, results are negative, and the patient has been told to follow up in 2 years. The workflow for this measure are as follows. There are 2 equally acceptable places in the chart to enter the retinal exam results. And I'm going to go through both of them. It's basically based on whether you're seeing the patient at the time you get the information or not. If you are in an inpatient encounter, meaning the patient's with you and you've got the chart open or you're doing your charts later in the evening, you can put the information that you receive in one of 2 places, and the data that you enter will transfer to the other section. You can either put it in under examination. You'll see a section for diabetic eye exam, and the little blue S means that this part is structured. It will open up the fields you need to answer for the diabetic eye exam. Record the ophthalmology results. If you're in the chart with the patient, is over in the clinical quality worksheet. You see when you go over here, the questions, if you hit the easiest way to do it really is to click here to answer. It will bring up the different questions and you can put in the information. It'll ask you if it's performed. It'll ask you the date that the eye exam was performed. You can enter that according to what you have from the ophthalmologist or the patient's brought in. Answer all of these questions, including whether there was retinopathy or not. And you have save your work, and you've met the measure. So again, there are 2 places to enter the information when you're in the encounter with the patient, and they will, if I put the information in the clinical quality worksheet, I will see it over an examination. If I put it in examination, I will later see it over in clinical quality worksheet. Now, if you are not in an encounter with the patient and you want to enter the data, say it's a different day and you've received the ophthalmology report as a scanned result, you can enter the information in as through the CDSS alerts as you do other ones. So here we have diabetes care ophthalmology. It's red because the information is not in the patient's chart. So similar to other measures, I'm going to click on history, and I'm going to change the date to the date that the exam was performed. Click on record lab values, opening up the diagnostic imaging results page. Just like other measures, I'm going to change the performed date to match the order date and make sure that this little box is clicked so that I see it in bold. I'm going to change the date as here as well. For this one, there is a pull down. I can select diabetic retinopathy or no retinopathy. I'm going to click reviewed, received, timestamp, and OK. Now it turns green here. However, if I go over to the clinical quality flow sheet, it will appear for all intents and purposes that I have not put the information in the chart. That's okay. When we look for the data at the end of the calendar year, we look in both places, in here and in the clinical quality worksheet. So you do not need to put it in twice, and you don't need to worry if it's in one place and not the other. There are exclusions for this measure. They include hospice or palliative care, you know, to go to other in the bottom of the clinical quality flow sheet. The other is the frailty exclusions, and we've talked about these before. The details of the frailty exclusions can be found in the written version of this workflow. If you put frailty in the chart, and the measure that helps you meet it for this patient will say she's got lung cancer. Okay, so these measures have, this exclusion has to be manually selected from here, add CPT in the visit code, and as we recall, there are 3 frailty exclusions. One, that the patient is greater than 65 years old with frailty and is on a medication for dementia. The other is that the patient is greater than 65 years old with an institutional special needs plan, or the one I'm going to use today is that the patient is older than 65 with frailty and an advanced illness diagnosis. And I can select the 2 related diagnoses from here. And this patient will be excluded from this measure and several other measures that we have reviewed for this reporting period. Thanks very much.